Alright guys, how's it going? This is Rashid from Unit.
Orman from Unit. Nice to meet you all.
Right on the camera. Today guys, what we've got for you, we've got some activation work, pre-activation work we're going to go through. So a big thing we want to focus on before you start your training as well, depending on what areas you're training. If it's you're doing a leg workout, you're doing upper body, you're doing full body, we want to focus on something called priming. Priming means you're almost preparing the body for what's to come, okay? So today we're going to look at the shoulders a little bit, your shoulder blades and how they function, and why you need to do what you need to do before you go and do military presses, overhead work, things like that. We want to make sure, specifically when it comes to the shoulder, which is a ball and socket joint, so it's working in a 360 motion, you want to make sure that you're encouraging that motion all the way through. So in another video we'll go through some capsular work that we can do to prepare the joint. However, today I want to focus on with Orman is just working on a muscle. It's called your serratus anterior. So I don't know if you've seen on guys, pretty athletic guys, you'll have almost feather-like muscles that come around the ribs.
Yeah.
This muscle sits underneath the shoulder blade and allows the shoulder blade to slide nicely on the rib cage, okay? You need this to have good function. So we'll tend to check for people that have winging scapulas coming out, and if there's any discrepancy, so if we flip you around this way, is there any discrepancy between the bottom 2 points of the scapula? So we know with Orman here, his left side's a little bit higher. We have a little bit more elevation of the scapula in this area as well. So again, it may be that we can look at this left side and target that as his problem area. If he gets any, have you had any injuries in the shoulder?
No, but I've been told my left side is higher.
Yeah, actually. So a little bit. There's different things that can contribute to that. Could be some scoliotic changes, so any curvature in the spine, which is fine, it's normal. Or again, this whole package of the shoulder is a very complicated joint. So again, we want to keep it simple today and just teach you how we can work on allowing that shoulder blade to stay compressed to the ribs, so that when you're doing these motions, you're getting good function and mechanics on the shoulder blade. Why? Because you want to avoid injuries to your rotator cuffs, okay? And minimize any type of pinching of the tendon that can happen from this forward rolling shoulder position. Make sense?
Yeah.
Okay, so a couple of things to do, really nice and easy. We're going to start quickly, just onto the front. So I'm going to get Orman to come into this position here. We're going to start on the knees to make it a little bit easier. And we're going to teach you how to activate your serratus anterior, okay? It's a very specific movement that will take a little bit of time to connect with, but once you get it, it really does, you can really feel it working. So what I want you to do, Orman, okay? I want you to allow your chest to go towards the floor, okay? So we're coming back up again. See if you can stabilize your hips and your core and just allow this motion here to come through. There you go. So he's actually got good connectivity with that. You want to really emphasize that curvature at the top, okay? That's where you're going to get contraction of the muscle, okay? The great thing with this exercise is you can actually integrate it in with some core preparation, some priming exercises, and we've done some of the workouts before.
Yeah.
So again, you're just focusing on just rounding that spine out as much as possible, dropping the chest in below, and again, rounding out. This will fatigue within about 6 to 7 reps. You're probably feeling it just about now.
Yeah.
Starting to come in, okay? You'll have a tendency to want to push forward on the elbows. You want to really try and sit back a little bit more. There you go. And now when he drops, see how much more difficult it becomes?
Yeah, pretty good.
Okay? You're going to naturally want to translate forward. So try and keep the angle of the elbow open as much. If you struggle with this, what you can do, if you get Orman on his back, okay? We're going to get this band behind, underneath your back. That's it. And I want him to basically thumbs up, so push it up, okay? You want to keep those elbows straight, and I just want you to allow your shoulders to touch the floor. So again, it's going to be a weird, there you go. Naturally, you want to open up, so you're going to be reaching up towards me, and then release. A couple of things here you notice with people, what they do is they hunch the shoulders down, so your cue is to try and keep the shoulders depressed as much as possible, okay? And your range of motion is very small with this. You're not looking for a big range of motion. So keep it small and sharp, so try again. So he's pointing up, and then he's coming back down. A couple of things that can support good shoulder function is obviously your core. Most people will have elevated ribs coming up, okay? We want to keep those ribs down. We want to keep the core on. Once you've engaged there, then you're working on your movements. And you can see how much thinking it takes to do, yeah? Big cue, shoulders to the floor all the way. and then pushing up. Okay, nice and easy. Perfect. So we're coming up from there. So super, you can see it's a little bit of a burner, okay?
Traps.
Again, if we want to regress that even more for those of you at home that are just struggling just that little bit, what we can do, or maybe come with me, we can get a wall, okay? You're going to get the wall, we're going to face it actually, we're going to turn the other way, 2 hands flat. You can see we're very organic with our videos. No feet are going to come together. Now when you bring your hands a little bit higher, okay, feet together for me, same principle, okay? If you look already, his hands are come a little bit higher than his shoulder, so it's going to encourage that hitching of the upper trap coming up. So let's bring the arms down a bit, and the other one. Now try the same. Good. So again, we're not lifting the shoulders up, we're letting the chest fall through, and then we're going to round. Perfect. And there's your motion. He's actually doing that really well because he's not having any additional movement from the hip. He's controlling the upper trap. You can see they're a little bit fatigued for him. Otherwise, technique's pretty good. The big thing as well is people are going to want to bend their elbows. So for you guys at home, minimize that bend in the elbow. This is not about reps and doing it quickly. This is about connectivity. You may only need 5 reps to really feel what you're doing. And you will really find if you start to play around with this before your workouts that you're going to get a real nice control of your shoulder. Your shoulder's going to feel like it's really packed together well, especially if you're doing any overhead movements. Obviously, there's a host of other things. You can stop now, it's good. You burn out. Yeah. There's a host of other ones that we can do that go hand in hand with this. So we can work on rhomboid activation, so looking at the muscles, again, in between the shoulder blade and the spine. We can look at releasing a lot of these areas at the front of the chest so that that shoulder is sitting nicely in where it needs to be. Most of us are in this position, start doing motions, movements in the gym, things like that, and then they wonder why they're getting pain. Basically, the shoulder is not meant to be in this position. It's meant to be in a really sort of posteriorly packed. Again, if we rotate Orman around, that's a nice packed position, shoulder blades in, postures on. And there's so many things we can go through in terms of your glutes and how your glutes affect how your shoulder blades sit. But again, we want to keep it simple for you guys at home. 3 exercises, serratus anterior. Have a look on Google, have a look on YouTube so you can have an idea of visually what it looks like. Implement it before you're going to go and do a shoulder dominant exercise or a chest dominant exercise.
Should people roll out their shoulders before they do anything then, in terms of getting the straight posture?
Yeah, I mean, it's back to priming. You're preparing the body for what's to come. So
before every lift, should they?
For me, what you can do, again, depending on what type of training you're doing. So if you're doing compound-based training, say you're going and you're doing 5x5s,
yeah,
you've got loads of rest time. You can definitely work through mobility exercises, activation exercises.
Yeah.
Again, serratus anterior work is perfect for that. And there's a whole host of other things you can do to encourage that shoulder to sit back in that position.
Yeah.
However,
posture.
In order to get that position, you need to have the range of motion. Mm-hmm. And that's why in the future, we're going to be talking about how you can release this front part of the shoulder, which, you know, everyone's texting, everyone's on the phone, everyone's on TV, on the laptops, how we can bring this back into this posture. So you get that connectivity.
Okay. And
that might be releasing your pecs, might be releasing your lats, your anterior delt, your bicep tendon. All of these things are going to be pulling that shoulder joint forward. Okay. So it's a very global approach you've got to take. It takes time. You definitely have to be patient.
Yeah.
But this is a prehab priming exercise, and it's still an exercise. Yeah. So it can still be part of your workouts, and it will still make you sweat.
Yeah, I felt that in my shoulders.
You know, if you're doing that in with a military press and some banded rotational work, yeah, you'll definitely be sweating. So that's just a little taster for you guys. We've got loads more to come. Feedback to us, ask us some questions. If you've got any injuries of yourself, give us a DM on Instagram, hit us up on YouTube. This is going to be up on YouTube for you guys. And yeah, excited to give you guys loads more.
Thank you very much.
Nice.
Thank you. That was quality. Thank you.